It is 1:03, and we're going to go ahead and get started on the Opioid Abatement Advisory Commission meeting. I am not Brian Hubbard, but I did stay at a Holiday Inn Express last night. Brian, he pulled a van and he double booked himself to be here and to be in Paducah. And so I will do my best to fill in for him today. Glad everybody could make it, and let's call the roll. Allison Ball.
Lauren Ferguson as property.
Thank you, Laura. Representative Danny Bentley.
He's on his way in Portland.
Okay, good. Vic Brown here. Karen Butcher
Here.
Carlos Cameron here. Eric Freelander here. Diane Ingram here. Ron Purdy
Here.
Lisa Brew here. And Sharon Walsh.
Here.
Thank you all. So our business meeting schedule, you have that on your agenda in front of you for 2023. We've got February 14th, March 14th, April 11th, May 9th, and June 13th, all at 1 p.m. and all at this building in this room. So that will carry us to the end of this fiscal year, and then we'll go from there. We sent out the minutes of the last meeting, the meeting of December 13th. Is there a motion to approve those?
I'll make the motion.
Second. Made by Jason Group, seconded by Eric Freelander. All those in favor?
Aye.
Opposed? And the motion carries. At this time, we'd like to offer the opportunity for any members of the public that would like to speak. They can come up here to this podium, and the commission will be glad to hear from anybody who has something to say.
First of all, thank you for the opportunity to get to share a little bit. My name is Dr. Eamon Couch. I am a leader of an organization called Partners for Rural Impact. We have been doing this work in Eastern Kentucky for 25 years, providing educational support for kids and for families. And our ultimate hope is to create a place, an environment where all kids are supported, cradle to career, regardless of zip code, income, background, or ability. I'm joined by friends of mine, Sue Christian, who leads our family engagement work in Owsley County, and by Jess Noble, who is a parent and a participant in the work that we do. We're here to share just a little bit with you about the impact that opioid addiction has had on rural communities and schools, but more importantly, to share the good news that through evidence-based practices like family engagement, that lives are being rebuilt, relationships are being rebuilt, while at the same time supporting the educational success of kids and their families. So,
well, like you said, I did family engagement in Abatement County, and I actually started doing that in 2011. One of the first things that I did whenever I started my programs is the grant that we were working with allowed me to create a lot of programming that was specific to our needs. And one of the discoveries that I made was actually by reading an article on Kentucky.com. And it stated that in Abatement County, we had 21.6% of our children that were being raised by somebody other than parents. We had the highest rate in the state. Although if you know much about Abatement, you know it's a very small population. But we're a population that has 3 drugstores for less than 4,500 people. It's a little ridiculous. But anyway, I'm not going to hammer that. But one of the things that we really discovered is that we had a lot of families that were broken. We had families who were fluid. We had parents who were in and out of the home. Sometimes it would cause a lot of behavior disruptions in the school. I served and worked directly in the school. But the tragic part is that parents who have children who are addicted, and I'm preaching to the choir, they want their children well and whole, and sometimes there's not enough resources to help with that. Abatement County, we don't even have our own drug court system. Our drug courts run out of Estill County. And sometimes a lot of the recommendations that are made for families is to find parenting support, find, these long-term supports to help families. But Abatement County we're kind of like the number, we're me and my group that I work with as a partnership over there. We kind of do a lot of the work ourselves through PRI over there. But Jess is in a program, and it's a new program that we've been partnering with Care to do. She's in the Ready to Work program, which is allowing her to go back to school and sit her own degree. But she's also doing a program called Commonwealth Institute of Parent Leadership through the Graduate Committee. I don't know how many of you know about that, but I kind of invited Jess today because I want her to tell a little bit of her story about how her opioid addiction kind of led her to where she is right now. And I'm very proud of her. She's not a big talker, but what she says is worth hearing. So I'm going to let her talk a little bit, and then I'll come back and kind of wrap us.
And my opioid addiction started when I was in my first round of college in 2006. I injured my shoulder and the doctor brought me a prescription for Lorazepam right away. It was quick to get addicted to because coming from a traumatic household, it just soothed all the things that I needed to soothe, and I really didn't know how to cope. Well, I went through my life and I was addicted that day forward. I really didn't think or see a way out. Didn't think I really needed one. I thought I could live my life out just being addicted without I really didn't think like. And I got pregnant with my daughter in 2016, and that's when I made the decision that I was going to change. And she needed more than that. She deserved better than what I did. And I went through recovery, and I'm still going through recovery, but I went and I did the hard part. I got hospital. And I just, and here in May, her dad, he experienced an overdose, he's now vegetable. And I just, and after that, there was no support there. I didn't really want to help me with her. And I was on my own. And the people with the cabinet for Health and Family Services, so I got ready to work. And since I've been in the program, I've realized that I can start over and I can do better. And I can break that cycle. And my child will live the life that I have been.
Thank you, Jess.
So the Ready to Work program, one of the things that they struggle with in Nelson County is finding placements for parents. And one of our local partners, Care, which I serve on the board there too, they literally provide a place for these young girls to work or young moms. And even dads, if they want to come to us, we operate in a small career shop there, but we do a lot of other things. We offer a lot of programs out into the community. But a lot of the programs that PRI has delivered to these families is Commonwealth Institute of Parent Leadership. We've also offered families and schools together, which has been, it's been a tremendous program for a lot of our families. We have people who serve on our parent task force at Care who are actually recovering addicts as well. And they have really turned their lives around, and they support their children in massive ways, but they need support. And so all these programs that happen in a lot of bigger communities, it's in our small community, it's a little more difficult to find those kind of resources. But there's people that are willing to do it. And I've been doing it myself. My friend Joanne Richardson is over here living. She's been doing the work for the last decade as well. And you know what? I thank you all so much for this. Has been a blessing because opioids has taken my community. And I'm glad to see that finally it's going to have to help give my community and others something back. So thank you.
Getting to hear from Sue and Jess is the real story. Not so much for me, but as a former retired superintendent and teacher and principal, and someone who hears from school staff across Eastern Kentucky every single day, I can assure you that nothing has had a greater impact on our schools negatively than the opioid crisis. The question is, how long will that impact last? School staff are spending a considerable amount of their time, and they love doing it, supporting their kids who are struggling, their families who are struggling with addiction. I talked to a high school guidance counselor last week. She said about 80% of her day is spent dealing with kids and supporting kids whose families are going through traumatic events, namely opioid addiction. The school staff, they're committed to meeting the needs of all their kids every day. And what we found is they want to take their kids. We know that there's high stakes accountability and testing. Those standards don't change. And so they want to take their kids as far as they can, but they're being put in a position where they have to do so much more than just teach and be providers of content. And so just supporting students in school isn't enough. There has to be a wider scope in play. And so as a former principal and teacher and superintendent, what we saw is on Fridays, those kids whose families were struggling with addiction, their discipline problems would increase exponentially. We saw that kids who had been taken out of their homes because of families being in addiction, when they had a chance to have a visit with mom or dad or someone, discipline would go through the roof. At best, you have complete disengagement on their behalf. At the worst case scenario, really serious discipline. Kids are sent into a tailspin. We must find a way to help make families whole again, all families. And so superintendents I've spoken with just this week tell me that healthy family engagement, and you've seen evidence of that here, is an essential component of what it takes to make that happen. When schools have a way to engage with all of their families, namely those who are struggling with opioid addiction, kids are served. And so as a result of that, the family has a team of people around them to love them and support them. And so we think, and we have evidence of it, that through family engagement, schools can become safe places for all kids and families. If you have any questions or would like to have more specific information about what we do or family engagement, or how to expand access into rural communities, that's in our name, Partners for Rural Impact, we're happy to provide more information and be a thought partner for you. Thank you so much for the opportunity to speak today.
Thank you all very much. We've got Nancy Tate.
Thank you very much. I'm Representative Nancy Tate from District 27, this committee in Northern Hardin County. And I was asked to come to speak today by Representative Bentley. So I run a transitional house in Meade County called Sierra's House. And I've also been involved in prison ministry for over 5 years. So one of the things that I can tell you is that the data, what I've seen in rural Kentucky, actually data and what I've seen support each other. You know, we already know everything. You know the statistics, you know what the information is, but I absolutely support what these people are saying, the people that spoke before me. We need to figure out a way to keep the families whole. And in our transitional house, we provide housing and jobs, transportation, anything that the ladies need to do in order to be able to be successful to get back into the workplace. The issue that I see is that, first of all, they've been incarcerated. And second of all, they've been separated from their children. The thing that they're telling me the most frequently is, why are we as a state providing the opportunity for the 3 strikes before we put them back, before we incarcerate them? Why not on the first strike? Why don't we determine what their issue is, provide them the resources that they need, and then keep them with their children as opposed to separating them with incarceration? One lady that we have, she's been separated from her children for 8 years. She had 4 children within a 4-year span. Now she's been separated from them for 8 years, and they've been shipped out with family members and also throughout the foster care. So just think about the trauma that those children have gone through by being separated from their children. So Sierra's House, our solution is not what I'm suggesting, because I'm dealing with people that have already been incarcerated. I'm saying let's prevent that. And the first strike, let's provide them the opportunity, the resources that they need. Now, one of the things, just thinking outside of the box, that I came up with is that, we do work release. We have the opportunity of doing work release. So for women, or for parents, but specifically women that have children that are school age, could we possibly provide them something like a drug rehabilitation facility. Because I think 64% of them have been demonstrated that they have drug addiction problems, be that legal or illegal drugs. So why not have drug facilities where while their children are at school or in childcare, that they can actually go to get the treatment that they need, and at the end of the day, then they be released in order to attend to the well-being of their families. That's kind of thinking outside of the box. I don't think that anybody, any state that I've ever heard of has done that. But this can take a lot of resources. And people say, well, yeah, but how much is that going to cost? Well, we look at the incarceration rate. What is it? $1.3 billion. That's what the bill is. So instead of incarcerating them, let's provide them the rehabilitation that they need, keep them with their families, and then avoid that incarceration and avoid the separation from the children. I can talk about this for hours, but I know that we don't have time for that. But if anyone has questions or anything for me, I would be glad to provide that. Thank you all for what you're doing. I appreciate it.
Thank you, Richard. And let me roll call reflect that Representative Bentley made. Glad to have you, sir.
President Stivers delayed me.
Dr. Forbes.
Hi there, good afternoon. First off, thank you so much for sharing your story. That's really what we're all here for, and what's out there. Thank you for having the courage to do that. Also, thank you to all of you guys, as well as the Attorney General, the Assistant Attorney General, for making this mission possible. We are at a pivotal point in history where the decisions that come to this committee and the impact of this committee and all of those that will receive support from this committee can do will not only affect tens, if not hundreds of thousands of people today, but it's going to affect generations to come. And that's what we're all here for, is how to make it better tomorrow. So my name is Dr. Dawn Forbes, and I am a neonatologist, as well as the CEO and founder of NASCEND. And both of those are located right here in Kentucky. NASCEND is a B Corp, as a certified B corporation, and we are also a public benefit corporation. And most recently, we completed the Kentucky Canopy certification, all in the mission of furthering our agenda of using business for good. NASCEND provides education and training through a certification that is enhanced by technology that works with improving outcomes through healthcare for opioid exposed infants and their families that are affected by substance use disorder with moms during pregnancy. So our outcomes, or our goal, is to improve outcomes in this population. We were fortunate and honored that we have partnered with Appalachian Regional Healthcare System as of this past June, and we will be submitting an application to the commission so that we can move forward with ARH to certify 5 of their hospitals, 5 of their delivery systems here in Kentucky to help improve their outcomes. So as you guys know, ARH is one of the biggest healthcare providers in Eastern Kentucky, and we are going to be working, like I said, with 5 of their delivery systems. Those 5 systems deliver over 3,000 babies a year, and 12% of that population is affected by substance use disorder and has problems both in the immediate newborn period and long term. Our goal in working with ARH and ARH's mission in improving outcomes for this population is to work to not only decrease the need to provide pharmacological intervention for infants that are going through withdrawal, to eliminate that altogether, but when it is necessary, decrease the decrease cost of care, improve family engagement, improve community engagement, and improve community healthcare and family outcomes. Through this partnership and this certification, we will be striving to do that through these 5 hospitals. Now, NASCEND has been around for about 6 years, and we have worked with several other hospitals, and we have been able to make a significant impact on these outcomes. You guys are very well of the numbers. You know that currently nationally and in Kentucky, we are treating upwards of 50 to 60% of opioid exposed infants with opioid-based medication. You know that their length of stay is averaging 20 to 25 days, and that is decreasing a significant cost. Most of them are taken on by the Medicaid system. Right now, what we are seeing in our outcomes and what we expect to achieve in our partnership with ARH and what ARH is committed to is decreasing that need to treat to less than 10%, decreasing that length of stay to less than 10 days, and truly engaging those families and improving those outcomes short-term and long-term. I appreciate the opportunity to speak with you guys today. NASCEND as well as ARH are excited for this opportunity and what we are striving to accomplish with this opportunity.
And certainly if you have any questions or you need additional information, so hesitate to reach out to us. Thank you very much.
Thank you, sir. All right, anybody else that didn't sign up would like to speak? Hearing none, we're gonna move on. We need a motion to break out into our subcommittees. So moved. Is there a second? Second by Bob Burke. All those in favor? If I'm saying aye? Aye. Those opposed? The ayes have it. Where are we at? Allison?
Treatment and recovery is in conference room C, and then prevention and reform and compliance are in conference room D.
Thank you all. We'll see you in a little bit. We can get a motion, we'll go back into regular business.
Motion to go back in.
Motion by Representative Bentley. Is there a second?
Second.
Second by Karen. All in favor, say aye. Opposed? Any ayes have it. So let me go ahead and announce the dates, the times, and locations for the prevention, reform, and compliance application review schedule. Their first meeting will be January 24th, 2 to 6 in this building. February 21st, 1:30 to 5:30, also here. March 21st, 1:30 to 5:30. April 19th, 1:30 to 5:30. May 23rd, 1:30 to 5:30. And June 27th, 1:30 to 5:30, all here at Capitol East. For the treatment and recovery application review process, our first meeting will be February 7th, 9 to 11:30 a.m. here in the building. All the meetings will be here. March 15th from 1 to 4. April the 5th from 1 to 4. May 31st from 1 to 4. And June 28th from 1 to 4. So we need a motion on this. Is there a motion to approve those meeting dates? Two meetings. Secretary Friedlander, is there a second?
Second.
Representative Bentley. All those in favor, signify by saying aye.
Aye.
Those opposed? And the ayes have it. We got just a few announcements, and we're wrapping up here shortly. Just a reminder, Lexington Town Hall next week, January 17th, at the Consolidated Baptist Church in Lexington from 6 to 8. But trust me, you all really know this, with Brian's going to be a lot closer to 6 to 9. But that's okay. That's okay. But I did want to throw that in there. Blake, are you here?
Yes.
Blake's got a couple of announcements.
Got my notes to cheat with. So two things Brian asked me to say. The first is February 1 at 1 p.m. If you want to mark your calendars, General Cameron will have a kickoff for the Fight Fentanyl Poisoning in Kentucky initiative. This will be at the Kenton County Community Center, and I'm sure Allison or Scott will follow up in an email with some requisite details and put it on paper so that you all will have that in your inboxes. But he just wanted to make sure that you all were invited and had that on your calendars as soon as possible. But we'll follow up in an email as well. Yes.
Is there a time?
1 o'clock.
And then, what's the date? I'm sorry. What was the date?
February 1.
February 1 at 1 o'clock.
And the second thing is he wanted to thank all of you for your work on getting the regulations done and done as quickly as you did, and just wanted to extend a personal thanks to all of the work that the commission did to get those in place and effective as quickly as we did, so that you all can start looking on the applications and start getting to work there. Those are in effect. They became effective earlier start of this month. So just wanted to make sure credit was given where credit was due to this commission for its work. And I know the staff, Allison and Scott in particular, in helping move some of that along. They deserve thanks as well. But Brian asked me to personally thank each one of you for ensuring that those got done as quickly as they did. That's all.
Where's your regular comment period?
And so that also be on the lookout for from Allison. This is why these notes are so helpful. There'll be a follow-up email in February for the first comment period on the emergency regulations.
It's February 21st.
February 21st.
And then there's another time here, March 21st.
And March 21st for the ordinary regs, when those emergencies convert to ordinaries.
Okay.
Those will be coming in an email from Allison, so you can mark your calendars. Thank you.
All right, if there's no other business to come before us,
I'm gonna be adjourned.
there's a motion to adjourn.
Second.
Second. All in favor, signify by saying aye.
Aye.
Vote. Thank you all. We'll see you in Lexington.
Thank you.
Next week.
Ron will be proud.